Hi, good afternoon. This is Jordan Dameron with the governor's office.
Well, hello everybody again, and now we're to the point in time, I guess, where we're trying to keep a distance between everyone, and so we're doing this, I guess, in this format today. I want to tell you before I go any further that just a development that just happened to me today, but over the last little while, just like all of us, get colds or a little cough or whatever it may be, and in doing so, I probably didn't pay a whole lot of attention to that. We all are worried, about what can happen to all of us. I've told everybody to not be afraid, to just be smart. And I've told everybody to not panic, to absolutely be cautious. And I've told everyone to in every way, shape, form, or fashion, that they should not in any way, shape, form, or fashion be afraid. Now, with that being said, a kind of an unusual thing happened to me today that I should report to you because you'll find it at some point in time anyway. And that is just this. I was told yesterday or the day before that our first positive in West Virginia was a person in the Eastern Panhandle. And then I was told that there was a picture taken and someone had shown the picture to some of the people in my office, and the picture showed me with the gentleman's that was our first positive in our state, his wife. And so, and it was at an event where I was giving away grants to our minority communities in Martinsburg. So I still didn't pay a lot of attention to the fact of being worried about that because that was on February the 15th. And so today, when I came into the office to go to several different meetings, I was abruptly welcomed by one of our people that was going to do a coronavirus test on me. And the reason for that is at that point in time, I was shown a picture of me with the gentleman that was our first positive. And at that time, I remember I gave he and his wife a big hug and congratulated them. They were recipients, of one of the grants, and I was really, really proud of them in every way, shape, form, or fashion. But our health community, which was our Secretary Crouch and our main man, our doc, Dr. Clay Marsh, said, you got to be tested, and you got to be tested now. And it just so happened that it all worked out to where the testing was, they were just grabbing a batch, and the batch was taken off, and then within a matter of hours, we were going to have some results. So I self-quarantined myself over at the mansion, and I sat over there and talked a lot on the telephone and all that kind of stuff, and then the test just came back, and it was negative, and so I just thought I'd go over that from the standpoint that everyone should know, and I am as transparent as I can be all the time and want to tell you the truth. So again, I welcome our Senate President, Mitch Carmichael's here today. He's always here, he's always concerned, and that's really good. Now, I also mentioned one other thing. When I tell you not to panic and be cautious, and I tell you not to be fearful and be smart, and I always tell you to not be weak, now's the time that we show our mettle. Now's the time that we show West Virginia strong. And so we're doing that. Now, today's, primary briefing will be just this. Yesterday when I left you, I went and called for our president And it just so happened that he was just getting off another call, and they passed me right directly into him. And so within 10 seconds of when I called, I'm talking to the President of the United States, and then we go over several different things that we need, and the primary thing we needed was to increase the supplies of swabs and whatever it may be in order to ramp up our ability to test. And so 45 minutes later, we get confirmation that stuff's on the way. Now, today, in addition to all that, today we're dramatically stepping up our testing with our commercial labs. And on top of all that, I am announcing today that we have now just got through doing it out of governor contingency dollars that we surely hope are going to be refunded back from the federal government. But we just bought 100,000 N95 surgical masks. We just bought them from a private business in West Virginia for $570,000. And all of these will go to our law enforcement, first responders, and corrections. Well, that's about 30,000 that are going to go there. And the other 70,000 will go in our DHHR, and they will administer them as needed. In addition to that, the National Guard today helped us in the purchase of 275 sets of highly protected suits that basically have a special filtering mask and the whole bit and all that kind of stuff for our health providers and our first responders. We bought those for $600,000. We're really, really, really happy to have pulled that off and everything, because that gives us an extra layer of protection. I also want to announce today, because, and I really don't know exactly why this is this way, but I guess everybody is looking to me or the government for guidance, but we had many, many requests from the standpoint of our barbers saying, we don't feel comfortable being that close, in that close contact with others and everything. The first thing that comes to my mind was then, well, why don't you just not do it then, But from that standpoint, I think, they're looking again to me or to us for guidance. So today, I'm asking that all the barbershops, all the nail salons, and all the hairdressing, facilities that we have shut down. I want to report to you on our feeding programs that we're having some bumps, and the bumps are, and they're legitimate bumps, but the bumps are, you may have certain people that don't feel comfortable being there, certain people that, that think that we ought to be doing it a different way and everything, and we're working through those bumps and everything in order to be able to, first and foremost, get those kids fed. And so we're working through all of it, and we'll some way, somehow, keep everything, all the supply lines going open so we can keep the kids fed. I don't know why these crazy rumors keep going around, but we're not shutting down our interstates or the West Virginia roads. Today, I have issued an executive order directing the Department of Commerce and Workforce West Virginia to provide unemployment benefits to those affected by the COVID-19 virus to the maximum extent permitted under the law, including those who are prevented from working or had their hours greatly reduced. The fastest way to file for benefits is online. We have removed all the obstacles, as far as the week waiting period and all this kind of stuff, to where we can start distributing funds to you immediately. And if you're going to apply online, apply on www.workforcewv.org. And so the changes outlined in this order will remain in place throughout the duration of the governor's recent state of emergency declaration related to COVID-19. Another thing I'd like to bring you abreast of is this, that all the WVU classes, as far as on-campus classes, have now been canceled and they are now, everything at WVU will be online for the balance of the semester. I guess my last thing today is just this, and this is, again, this falls back, I think, more on the responsibilities of all the funeral homes and the funeral directors. But, you know, when a loved one passes, we absolutely all have to bring some level of closure to that and some level of mourning. Now, all I would say to you is just this. Some families are deciding to go to just the immediate family. I would say to any and everyone, from my standpoint, I would say this has to be a family-to-family decision. This is not my decision to be making. You know, we want to observe and protect the rights of all those, and surely at this time, you know, this is not a place for me. But I would tell you all just this, that as you're going to pay your last respects, a funeral home setting seems like it is just ripe to cause us all even more harm. So be careful and keep your distance. Oftentimes, the elderly are paying their respects, and we all know that the elderly are the most susceptible in this situation with this terrible virus. So as we line up arm in arm in a funeral home setting, paying our last respects, that's not good in a lot of ways. So keep your distance. Use that 6-foot rule and try as best you can to pass on all of your respects in every way, shape, form, or fashion. But try to do it in this time in a really, really safe manner, because we're trying every way we possibly can to keep us apart as much as we can. So, like I said, all this stuff carries with it tough decisions, really tough decisions. And when you've lost a loved one, it's really, really, really special and really tough. So all I would say is try as best you can to follow all the things that I've already mentioned several times. Wash your hands. Use good hygiene, protect yourself or protect others as you cough and sneeze. Try to stay 6 foot apart, you know, and the more you do that, the less this terrible virus and terrible disease will have any power. And so that's the whole word, that's the whole key, power. Let us use our power. And our power is being separated, and that in itself shuts this terrible disease down. So, from my standpoint today, you know, I awakened to a situation that it's hard for me to believe, you know, in a lot of ways, to tell you the honest truth. But it's testimony to the fact that I'm everywhere. I mean, we have 2 positive tests in this state, and I'm with one of them. So you know, and I wish a great outcome for that gentleman in every way and his family, and our prayers are going to be with him. And like I said many, many times, with the grace of God shepherding us in every way in this great state, and us being smart and giving and doing the things that God has given us the ability to do, we're going to be fine. We're going to be fine. Now, the last I would tell you is just this. I have asked all West Virginians, and I will ask and plead again. I have asked you over and over and over. in the most gracious way, in a volunteering way, help the elderly, go to the grocery stores for them, embrace our moment here in time, a pandemic. No living West Virginian has ever been through this before. Never. Never. Let's embrace the moment and use our power. Stay separated, because if we don't, and I don't say this to scare you in any way, shape, form, or fashion, many will die. Watch the TV. Watch what's going on in areas that didn't react as we did. Watch what's going on in areas that don't have the most elderly or the most chronic diseases and everything that we have right here in this state, the highest risk state, us. But we're trying in every way we possibly can to be the state that leads the way, the state that was proactive, the state that absolutely had a preparedness, the state that is reacting in a way that great West Virginians do, and that's helping one another. Help one another. React. Stay home. Please, businesses, any function that our people can do at home, stay home. And so in every way, if we'll do just that, and we'll work from home, and we'll be smart, and we'll stay on top of our game, you know what will happen? We will become the place. We will become the shining light, the place that everybody wants to come to after this has passed us. We, West Virginians, that everybody used to think of as the dark, dingy, backward state, we, West Virginians, will become just what we are already becoming. An economic engine, the absolute treasure that everybody missed, the diamond in the rough that everybody missed. We, as West Virginians, will become just what we want to be. The very place where everybody will want to come after this thing passes us. It is an opportunity for us in so many different ways. Please, first and foremost, know, and I'm going to say it one more time, know just this, that your power is to be a part right now. It crushes this disease. In addition to that, I will promise you beyond belief that for our businesses, for all of our employees that are all over this state that are wondering what is going to happen next, how am I going to live from paycheck to paycheck? What am I going to do with my power bill or my taxes that are due? And for the businesses that are traumatized by the loss of business and everything else that goes with it, what am I going to do? Well, here's what we're going to do. We, as a state, we, as a nation, are going to step up through stimulus packages or whatever it may be to insulate and underpin every part of your anxiety and worries. But we can't bring your loved ones back if you don't react in a way right now. From an economic standpoint, we'll underpin and we will absolutely ensure everything that's going on as best we possibly can. But we can't bring your loved ones back. Just stay with us, stay with me, and let's really, really, really try in every way we possibly can to live our lives, but stay separated for a period of time that gets us through this. Now I'll turn it over to these great gentlemen and ladies, and they can talk, and I'll just lean back and try to listen as best I can.
All right, ladies and gentlemen, as part of our briefing today, our friends with the media are joining us virtually by teleconference. We'll be happy to take their questions in just a moment, but first, we're going to take some comments from the rest of our panel, and we're going to start today with Secretary Bill Crouch with the Department of Health and Human Resources.
Bill, before you jump in, let me say this. The closing of our barbershops and our hair salons and our nail salons and everything, to be consistent, It will be the same as it has been with everything else. 11:59 tonight, we're done. And so please follow that as best you possibly can, and I promise everything will be okay.
I don't know if I can say it any better or any clearer than the governor. He's made some very difficult decisions for West Virginia that will make a huge difference going forward, and he is not exaggerating. It will save lives. We are doing the right things. We're ramping up testing. We have additional tests coming online daily from commercial providers, so we're going to see more tests being performed. Chances are we will see more cases in West Virginia, positive cases in West Virginia. We need to all do exactly what the governor talked about, which is to use social distancing, keep that 6 feet from each other where that's possible, and to not touch your face and transmit this virus through your mouth, your nose, or your eyes. So please take heart and make the right decisions, and again, help your parents, your grandparents, and your great-grandparents. It's extremely important that we take care of our families. So I would urge everyone to do that.
We're also joined today by Dr. Kathy Slemp, the State Health Officer and Commissioner of the Bureau for Public Health, if she'd like to make any comments.
Thank you. First, I too want to say thank you to the governor for his clear message on the importance of doing these activities, and to all of us really pulling together effectively to make this work for West Virginia. I want to talk a little bit about what happens when we have a positive case. So public health does this all the time. We have infectious disease reported to us, and so if we have a case of COVID-19, there is actually an investigation that begins. So with each of the cases recently, and with each of these next several cases, we have a group, a person that actually begins to investigate that case. So they have talked to the individual, they identify and find out how they're doing, what the risk factors were, they identify who might have been contacts that could have been at risk, and may have been exposed, and who's not. And then they do the follow-up with those individuals. So if someone's been at risk, has been exposed, then they would now contact that individual and determine how they are doing and what they need to follow up with them. Do they need to be tested? Do they need to be staying home for 14 days? Those kinds of things. If there were some large public exposure that we felt was a high risk, we would let that be known in the community. So I think I just want to be clear that there is a very specific investigation that happens with that. So if you are not contacted by public health or by an individual to say you have been exposed, you don't need to worry about that risk in that setting. And so we just want to be able to be transparent with that of what happens. And I say that because what happens when folks try to get lots of information and they start social media rumors is we actually disrupt things. And we see that, for instance, we ended up with impacts of the healthcare system because of social media rumors around cases, or impacts on our on our response operations. So all of those are things that if we can keep from following the rumors and really function on facts and information, know that we will share what people need to know. We also want to protect the confidentiality of the patient and that investigation. So thank you.
Dr. Slemp, thank you very much. We'll now move on to Major General James Hoyer with the West Virginia National Guard.
Good afternoon. At the governor's direction, the Guard continues to provide support to a variety of state and local agencies across our state, to include Department of Health and Human Resources, as well as Department of Education. As the governor mentioned, ongoing efforts to continue to support and serve and feed our children is going well, according to Dr. Birch and the Department of Education. The folks in the volunteer organizations active in disaster have mobilized their efforts to begin to continue to work to take care of our citizens. I would remind folks again, if you have a non-emergency or non-medical requirement, the 211 system is now in effect and being manned, so you can call that number and seek assistance and support where necessary. The other thing that we continue to do at the governor's direction is, I hope folks remember during this time, we have almost 1,000 guardsmen who are deployed overseas, and one of our responsibilities that the governor makes sure that we're tasked to continue to do is take care of those families during these trying times. Thank you.
All right, Major General Hoyer, thank you very much. We'll now move on to Dr. Clay Marsh with the West Virginia University. He's the Vice President and Executive Dean for Health Sciences.
Well, I'd like to start off my comments in talking about our governor. And the first time I met Jim Justice was at the Greenbrier, and he told me at that time that he was a caretaker. And I think that these have been unprecedented times. We have never been in such a condition. And the last pandemic this country faced was back in 1918. At that time, 50 to 100 million people around the world lost their lives. And so what we've learned from that and from the experiences that we've seen in Asia and Europe is that acting decisively, but acting very proactively, saves many lives, many, many lives. One person in South Korea who was exposing himself to others infected over 1,000 people. So as we go forward, the thing that we can do, which the governor has stepped up and led us, is that we can start to use the weapons that we have at our disposal. And many people would say, hey, that's pretty mundane. Oh my gosh, you know, separating from each other, washing your hands, really? Or is that the only tools, or those the only tools we have in our tool belt? But in fact, those are really powerful tools, because this virus thrives on having people come together, spreading between people. And the governor has made a set of very, very difficult decisions because he loves people in West Virginia. He understands that this is going to be a hardship on some people economically. And this is going to be a hardship on people that want to be with each other and rally and come to church together and go to basketball games and go to the state tournament and go to the games that you're coaching, the kids of our state, which the governor has done many times. But this is a time for us to be strong and understand that what we do today will have huge ripples on whether we go down one path, which is the path of showing everyone else in this country how to succeed, because we know a single day of not doing the right thing in 2 weeks can lead to 40% more of people being affected with this disease. And as the governor said, by the Kaiser Family Foundation, West Virginia has the most risk for our population of any state in this country. So if we get the tsunami wave to overwhelm our healthcare workers and we can't take care of our people, it's going to be a very sad set of days coming up in the state of West Virginia. But if we follow the governor's counsel, his decision-making, his vision for a great future, then we are going to be the place, the Phoenix Rising, that everybody looks to. And I would say for me, as one West Virginian, I am very proud to be a citizen, and I am very appreciative of the leadership that Jim Justice is showing, which is not only saving lives, it's changing futures, and changing the future of not just a family or an individual, it's changing the future of our state. And remember, if we overwhelm the healthcare resources we have, the death rate around the world is 3 to 5%. And if we support it, we take the tsunami wave and make it a river or a stream, it's 1%. And the purchases done today by the state with the masks and the suits are going to save healthcare workers' lives if we do run into problems with this disease, which we certainly will. But the decisions to do what we can do as citizens to help care for each other and separate, wash our hands, stay a distance, that will have a pound of prevention in this way is worth 1,000 pounds of cure. So thank you, Governor, for what you do every day and your leadership, and also to the people of West Virginia who, by serving each other, are going to make the future of the state very bright.
And now for the final member of our panel today, Steve Roberts, the President of the West Virginia Chamber of Commerce.
Yes, I too want to add my thanks to Governor Justice. Governor, thank you for the leadership that you're showing at this time. This is a time that really calls for your kind of leadership, and we appreciate it very much. Thank you for your transparency. Thank you for your care and concern about people who might have lost their job just recently. And thank you for your showing your heart for those who are in mourning. So thank you very much. And thank you to our healthcare providers who are here. We know that the healthcare system is stretching itself to its limits. All of us are doing everything we can we're keeping you in our prayers. We are looking for the materials that will help you do your jobs. And from a business point of view, I have to echo what my friend Dr. Marsh has just said, which is I think West Virginia is really showing the rest of the nation how to do this. I am hearing from company after company that is sending its people home to work remotely, that is practicing social distancing. The companies that are following this the most closely are following the rules the most closely, and I am hopeful that all others will follow suit. We today reached out to 4 technology companies and said we believe that particularly small businesses in our state may not be equipped to work remotely. All of them immediately offered their services. Some of them are providing free services for the next 90 days to help companies that are not connected, whose workers can't work from home, to get them connected to a server so that they can telecommute and work from home. So the right steps are being taken. I continue to be optimistic that we're doing the right things, but I want to say to all the employers in West Virginia, we have to keep doing the right things, because the way to get over this is to limit social contact. And we can't drive that home enough. We have on the West Virginia Chamber website, wvchamber.com, a whole list of resources, a whole list of the recommendations of the CDC, and all of the contact information for those agencies that can help. Finally, I want to say a word of appreciation and drive home the point about how important it is that the governor has taken these steps related to unemployment compensation. I believe people are fearful. People who lost their jobs quickly and without any ability to prepare for that are really worried about buying their groceries, making their car payment, paying their rent, making their house payment. And I am so glad that you have taken steps to waive the 1-week waiting rule and to make people immediately who have lost their job or whose hours have been very substantially reduced, to have made them eligible for unemployment compensation. Over the last 10 years, largely led by now Senator Mitch Carmichael, changes were made to our West Virginia's unemployment compensation fund, and the last time I checked, we had a balance of nearly $150 million. Most of the money into that fund comes in April and May. So while there will be stress on the fund and money will be going out, the payments to the fund, the largest series of payments, come in April and May. So employers will be putting lots more money into the fund. I'm so glad we shored it up. We shored it up in part by transferring some money from the insurance tax over to shore up that fund when it was needed over 10 years ago in a crisis, not of this magnitude, by the way, but in a crisis where there were lots of hits on the fund. And we're glad the fund is there. We want it to be there. We want people who need it to know that they have that assurance that their state unemployment compensation fund is going to help them through this crisis. There are other ways that we're going to be helping. There are lots of other things we can do. We can look after our neighbors. We can offer to take groceries to elderly people who appropriately shouldn't be going out, and I see that happening every place that I look. So thank you to all of you. Thank you to healthcare providers. Thank you, General Hoyer. Thank you, Governor Justice. I believe in West Virginia we are taking the right steps, but we must continue taking the right steps, and we must continue with social distancing. And that is how we will keep this from being as severe as it might otherwise be. My father is 94 years old, lives in the Woodlands in Huntington. I call him and he says, look, I understand we don't want people here. We are sitting no more than 4 to a table. And he said it's interrupting our bridge game a little bit because we have to separate a little more than we want to. But we as elderly people understand. And I think if you can hear that from somebody who'd really like to see his children and grandchildren, all the rest of us can tough it out.
Well, let me just say this, and then I guess we'll open it up for the questions and all that kind of stuff. But I can't thank all of these wonderful people enough. I mean, they're doing tireless, phenomenal work, and our general, who doesn't have a chair, you know, but you know, I've got to say this because, you know, while it's easy to try to remember as much as you possibly can, the one thing we don't want to forget is our general mentioned, you know, we've got 1,000 people that are serving in our Guard all across this globe now. And they need your prayers in every way. You know, they're protecting us. They're giving us the freedoms that we take for granted, to tell you the honest truth, almost too much. But really and truly, they're in probably many parts of the globe that things are maybe even worse than they are right here from the standpoint of just this virus. So, you know, General, I've said it 1,000 times, we owe everything in life to those people, to you, to our military that has done so much for us in every way. So not only do I thank all y'all, but I surely want you to pass on my feelings to all them as well. Now I guess we'll open up to whomever.
Thank you very much, Governor Justice. In the interest of social distancing, we're holding today's briefing with media members from about 10 outlets joining us virtually by teleconference. Now, to ensure that all outlets have an opportunity to ask questions, each outlet will be given the floor to ask one question. The order has been selected at random. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. And for a limited time following the initial run-through of questions, follow-up questions will be permitted. We ask that our participants use the chat feature on our teleconferencing platform to submit those follow-up questions. And with that, we'll start it off. Our first question asker will be Amanda Barron with WSAZ.
Hi there, can you hear me okay?
Yes, we can hear you.
I can't, okay, good. I wanted to ask, and I'm not sure who this is best directed towards. Once the supplies that you're talking about, the 100,000 masks, the 275 high protection, highly protective pieces of gear get to West Virginia, to where will they be delivered, and how will you decide where they go, and how quickly will they be dispersed?
Well, let me kind of just throw in this. You know, Amanda, of the mask, 100,000, 30,000 of them are going to really be going to our emergency responders and all those. And the 70,000 balance is going to DHHR to be dispensed. But the general knows more about this than I, and we'll let him speak.
So one of the logistics missions of the National Guard will be to support the Department of Military Affairs, Public Safety in this case, as well as DHHR, to ensure that those items are moved to the appropriate locations and that the various agencies and individuals have access to those.
And how will you decide who gets what?
So the Department of Military Affairs and Public Safety will be working with the law enforcement. Department of Health and Human Services will be working with the medical providers who need those sets, and then we'll provide, based on their guidance and direction, the movement of those supplies to the appropriate locations.
All right, thank you. We're going to keep it moving now, and we're going to go on next to West Virginia Radio and West Virginia Metro News with Brad McElhaney.
Hello. Could you all expand on what you know about the Mercer County case, the degree of illness, whether that's another border county, whether it was transmitted across the line, and, you know, without invading the privacy of the person, to what degree the investigation that Dr. Slimp described has been accomplished so far?
The case was travel related. Exposure was out of state. Individuals doing well, and the investigation began last night, so they are actively underway. So I think it's well underway and moving forward, and as we would expect. And you'll see other cases that come in the next few days, and we will do the same thing there. So it's doing well. Thanks.
All right, thank you, Brad, for your question. Next, we have West Virginia Public Broadcasting and Dave Mistich.
Hi, folks. Can you hear me?
Yes, sir. No, we can hear you.
Great. I'm curious if you could tell me why the state DHHR is not counting tests run by other labs that are not the state lab, and what assurances are in place that those labs are reporting positives to the DHHR?
Sure, I can speak to that. It is a reportable disease, and we'll be receiving any positives that occur. Interestingly, with this event, we've actually asked for the negatives as well. And so we are receiving the negative results from several of the commercial labs. And so we've essentially doubled the testing the reports we received had doubled the testing to date. And then we know there's much more happening that will come out in the next few days. So we actually are looking at both.
All right, Dave, thank you very much for your question. Next, we're going to go to the Dominion Post and David Beard.
Can you hear me okay?
Yes, sir.
Okay, this is for the governor. Senator Manchin said that Fairmont Regional is closing tonight. And earlier today, Marion County's 3 delegates sent you a letter asking you to use your executive power to keep you open. I wonder if you've read that, and are you considering doing that?
Well, first and foremost, let's go back and just think just for a second. You know, I've been involved with the Fairmont thing for months now, and just to be perfectly fair, you know, we were in a situation where we were going to lose Fairmont completely. And in fact, we were going down a pathway to where we were going to end up with probably 10 emergency room beds, or basically an emergency room type setting of a holding pattern, and our 7th largest city in the state would be without a hospital. You know, well, we worked really, really diligently because that wasn't satisfactory with me, and we worked really hard, and what we ended up with, where we ended up landing, was just this. Not from the standpoint of the Fairmont Hospital just closing, period, and then us going and building, and then some 15 months or whatever later, we end up with 10 beds in a community like Fairmont without a hospital, without jobs, and on and on. And so where we landed, though, we landed in a place where we landed with a 100-bed hospital, and which is probably 18 months to 24 months away. And in the interim period, what we would do is we would go through probably a 30-day window, and that 30-day window, maybe 45 days, but Fairmont would have to close in order to get the CON moved over, to get new or better equipment put in, because the equipment that's there is all leaned up in all kinds of different ways. And it's way, way, way more complicated than just saying, well, let's just do this. Now, with all that being said, now I'd like to, and I hope I'm not getting out over my skis in this, but I think there's a way, if WVU is willing, I think there's a way for us with Secretary Crouch to move the CON process in some ways over to the side to where we can immediately put WVU in there. And so there's all kinds of things that we're doing, plus Secretary Crouch is doing this. Right now, and I did this yesterday with the president, but I am requesting, all types of supplies that we have those supplies and log those supplies at a Fairmont or a Wheeling or wherever it may be, that we have beds in case we have an emergency situation. So all that being said, you know, we've been on it, we're still on it and everything, and it may very well be that we can move the process along to where we don't have Fairmont closed for the 30 days. And in addition to that, we have Fairmont as a real backup, along with a Wheeling or Sistersville or wherever we may find beds, and we have the equipment to be able to handle an emergency if we have that, God forbid.
Okay, David, thank you very much for your question. Next, we're going to move on to West Virginia News and Joanne Snodderly.
Hi, can you hear me?
We can.
Oh. Hi. I am wondering about the status of ventilators in the state. You mentioned just now and yesterday that you'd like to see some emergency, temporary centers maybe set up. Do we have the number of ventilators that we would need for something like that?
We are we keep an inventory in the Bureau of Public Health for emergencies. We know what the bed capacity is. Our hospitals are working very hard right now. We want to make sure we provide the necessary equipment and necessary supplies to hospitals, to all hospitals. We have hospitals who notify us that they are short on certain items, certain testing items, and we provide those as quickly as possible to them. So we're working hard again to try to get all of the products we need, all of the items we need. I will say our two senators in Washington, Capito and Manchin, have been very aggressive in terms of trying to help. They're in constant contact with me. In fact, I owe them both a call right now. We're doing everything we can. With the governor's call to the president, we think we're going to get more equipment and more items from Washington. I'm going to be on a call after this meeting with someone in Washington to talk about that. So we're working very hard on that, and we think we're going to make progress on that.
Please.
So I think the other really important issue, though, to remember from our questioner is that having the supplies and tools, the ventilators, the machinery, the technology, the beds is really important if you get into a situation where you have surge that comes at you. But the limiting factor is always the healthcare workers. So by getting this protective equipment to enhance our ability to support the healthcare workers during that kind of a surge is really the single most important thing we can do to try to make sure that we can provide the care that every West Virginia citizen deserves.
And one little follow-up to that, the protective suits are reusable, where they can be cleansed and then reused. And so that's good too. And I want to follow up on one thing about the ventilators from the standpoint of, Secretary Crouch, and that is just this. Yesterday on the phone with the president, today on the phone with the president and the vice president, it was mentioned today that what we should do is continue to try to source every source that we can, but the federal government has ventilators in which they would step up and send our way too. And so, again, we don't want to ever say never, but I think we're okay there.
Okay, Joanne, thank you for your question. Next, we're going to move on to Lindsay Renner with the Cumberland Times-News. We just lost Lindsay, so we'll give her a chance to log back in. In the meantime, we'll move on to WOWK with Rick Johnson, I believe.
You guys got me?
I assume this is Lindsay.
No, this is Haley Kosick with WWK.
Okay, even better. Go ahead with your question.
Okay, I suppose this is for Dr. Kathy Slemp. You mentioned that the state is going to be ramping up testing, and I've been seeing a lot of posts on social media with a lot of local medical centers conducting their own drive-through testing. Does this fall under the DHHR, or are they taking their own liberties, and what are we going to be doing in the future to make testing more accessible?
You know, we really try to work collectively, private and public sector together. So we are encouraging health hospitals and other entities that can do that to absolutely do that. We've got local health departments that are starting to do that as well. We are getting more supplies that we can provide to those folks to do as well. So we are really trying to take it a partnership approach.
Thank you.
Okay, thank you for your question. Next up, we have WVVA, and I believe the question asker is Annie Moore. Okay, we're going to move on next to the Bluefield. Is that Annie?
You got me?
Perfect.
Yeah, sorry about that. Okay, I'm ready now. Do you have any plan to keep daycares open or bring teachers home?
I didn't hear the question. Could
I believe the question was whether there were any plans to keep daycares open or bring teachers home.
So this time, we have actually asked the people to try to keep daycares open. It's a really critical piece. Several organizations are starting to work with healthcare centers to really support childcare for our healthcare workers, and that's a really important piece of maintaining our healthcare workforce. So that we want to make sure we do everything we can to support that healthcare and other essential service personnel, so that they have childcare that is safe and effective while they can get their job done that we've been asking them to do.
Okay, thank you for your question, Annie. Next, we're going to move on to the Bluefield Daily Telegraph and Emily Rice.
Hello, can you hear me?
we can.
Hi, Governor. I had an interview with our Mercer County Health Department this morning, and as you know, the second case was found here in Mercer County yesterday. And they have absolutely no testing kits. They're having to send people to actually travel and interact with other people and possibly spread it further to get tested for it to begin with. Can you give us, I know this question has been asked, but some kind of timeline on when these resources are going to be allocated to more rural counties?
We actually have can absolutely get them testing kits if they need it right now. Those are available to them at their request. So we've been probably working behind with them as well.
Okay, thank you. Thank you for your question, Emily. We're going to go on next to
Nathan, let me comment on this just a second.
Yes, sir.
You know, and this has been a big concern. It's been a big concern of ours. It's been a big concern of several of the good people in the media and everything. Amanda and Emily, I think both have asked questions in regard to the testing supplies and everything. And I think, you know, this is fair to say that the world had a shortage of testing supplies, or at least the U.S. had a shortage of testing kits and everything. And we had 500 in the beginning, and we were making our way and doing all that, and then we were trying to get additional swabs, and we were trying to get, you know, mobile units and all that kind of stuff, and we felt like, we're going to run out, we're going to run out, we're going to run out, and I think that wave is getting resolved. And I think, you know, Dr. Marsh, you know, you've heard from Dr. Slim and Bill and myself, but Dr. Marsh has probably got some data, you know, as to what's going on with the mobile units at WVU and in that area and everything. And Dr. Slimp and you know, I really believe that we're really kind of putting that behind us to a degree. But
yeah, I would just say this. This is Clay Marsh. That we opened up our mobile units in 5 parts of the state, and we have tested now about 300 people in the last 2 days, and we are hoping to increase that. You know, the commercial vendors, LabCorp and Quest Diagnostics, have been supporting us along, certainly with the state lab. So we are very much optimistic that this sort of threshold, this ceiling, is starting to be broken through. And we know that the most effective countries in the world both do the social distancing that the governor has promoted and talked about, but also do very thorough testing of the population. And so we want to bring that to all of West Virginia as quickly as we can. And I think the governor's leadership and the administration's leadership, they have really tried to short cycle a lot of the challenges that oftentimes occur between private vendors and state agencies. And I think that's really good.
Let me just add one thing to make sure we're clear. We will be reporting all of the tests as they're completed. We're working on electronic connections to the private laboratories, the private testers out there. Some of those are still submitting paper, so it's a little slow in some areas, but we're working on that electronic transfer of results so that we can report those to you daily, and you will have that information. Again, we're striving to be very open, very transparent in what we do and how we do this.
The other thing I would say is this is where you think about your public supply being used for highest risk. So we would always want to prioritize those case and contact investigations for those testing supplies. That's what public health can do. And then as we have increasingly ability across the private sector to do those others, that's really helpful.
Okay, Emily, thank you very much for your question. Next, we have Stephen Allen Adams with Ogden Newspapers.
Yes, can you hear me?
We can.
That's great. I might have missed this just because I had a brief audio issue at the beginning of this conference. I know you said that you've been tested and those results have come back negative. I know I think you said that you had contact with this guy in mid-February, the Jefferson County case. When did you find out specifically when you had contact with him? Because obviously we all found out Tuesday. When was that? How long did you self-quarantine? I only ask because we were all with you yesterday briefly. So,
well, to be perfectly honest, Stephen, I knew that I had come in contact with his wife a couple of days ago. But when I walked into my office, here, earlier, and laid out was the rubber gloves and the testing stuff, and I thought, well, what is this? And then they brought me a picture of the gentleman standing right beside me with his thumb up and everything, and I remembered him at that point in time, and Doc and Mr. Secretary were saying, you have to be tested right now. And it just so happened they had a batch going out right at the time, and they said, as soon as we test you, you're going to have to go be self-quarantined until we get the sample back. And then if it came back positive, then y'all would probably have to be without me for 14 days. But so nevertheless, I went over to the mansion and just hung out and everything and waited, and 3 or 4 hours later or whatever, they came back with the test that was negative. So that's the first I knew about it, though. Yeah, it was good. I appreciate you asking. I thought, well, surely goodness, somebody's going to ask, but maybe y'all would rather I be gone for 14 days.
Okay, thank you, Stephen. We're going to move on now to WCHS, and Kenny Bass is on the line.
Hello, just a quick question for the governor. I was actually going to ask you if you should be tested for the virus because of how much you become in contact with people, but you've already taken care of that, so I'll move on to this. With the unemployment compensation benefits that you're now offering people who are directly affected by the closure of their business, is there any plan to talk to the Attorney General to see if the broad authority you have under the state emergency would allow you to suspend rent and mortgage payments for the duration of this thing in order to help these people not only pay their rent, but also to live if their hours have been drastically cut? And in the theme of protecting workers, it's been brought up several times to me, and I told them I would ask you, what steps are being taken to protect West Virginia Turnpike workers who are coming into contact with thousands of people a day, literally, and are handling money, which, as we all know, is pretty filthy?
Well, Kenny, let Secretary Crouch or Kathy do the second part, and then I'll come back to the first part, okay? The second part was the turnpike workers, and if y'all could do that, y'all could do that better than I.
Go ahead, Kathy.
Sure. And I think like any employee, you look at that in terms of what's the risk. And so there's a fair amount of space between the car and the individual. It's outside. There's aeration with that kind of thing. They handle money every day. And so they are always looking at that. So I would expect that folks are working with them for how to handle that appropriately. Again, I would not think of money as a high risk activity.
Okay, and I think, Brian, were you going to answer part of the other question? And then I want to follow up right behind that, McKinney. But come on up here, Brian.
What we were tracking yesterday was that the federal housing has issued until the end of April a ban on evictions and a ban on foreclosures. So we're hoping that that's going to provide the relief until the federal aid gets here. So I don't think there would be a need to try to intervene and suspend contracts between individuals and lending institutions.
And Kenny, I want to follow up by saying just this, is we're trying every way in the world to let people know that some way, somehow, they've got to understand that, I mean, let me put this, I'm always the one that kind of tries to make it simple. Quit trying to count the legs of the cows and divide by 4, just count the cows, and just think about this for a second. Our nation is coming with a $1 trillion stimulus package that basically is coming out now. Now just fathom this. First of all, one of the first steps was $100 billion. Now it won't be evenly divided, but if it were, West Virginia would receive $2 billion. $2 billion into our state equals nearly half of the total revenue of the state. The total budget. Now, that is $100 billion. But the nation is coming with $1 trillion, which is 10 times that number. So our nation is doing what we should do. And President Trump should be commended in every way. But our nation is stepping up. Now, if it need be that our state should step up additionally to that, that's why we have rainy day funds. And I would say right behind all of that is just this. Some way, somehow, everyone needs to, and I know you can't just eradicate it from your mind, but some way we've got to realize the most important thing is we can't replace lives. We'll get through the hardships of the economic barriers. And the other flip side of it is just this, and this just came, and it just happened in the last 5 minutes. But the Small Business Administration we just got an update that West Virginia is now an economic injury disaster zone. And basically the economic injury disaster zone program is now in place to where people can go online and find out all the particulars of this. And this is where businesses, small businesses, can secure loans and get badly needed immediate cash to be able to pay employees or pay insurances or taxes or whatever it may be. So go online right now. This just came to us, and so you ought to be able to get a whole lot of information from that as well.
Okay, thank you, Mr. Governor. And with that, we're going to wrap it up for today. Believe it or not, no follow-up questions came through on the chat. We'd like to thank all of our participants for being flexible and bearing with us. Any follow-up questions that weren't answered in today's press conference, you can submit those in writing. Thank you for your participation, and everybody have a good day.